and I am the first cosmetic gynecologist in Navi Mumbai, Kharghar. We are the owners of Ornate Nursing Home in the name of Ornate Hospitals in Kharghar, and we have a 30-bedded, beautiful state-of-art hospital, which includes all and every facility for right from maternity to cosmetic gynecology, to laparoscopy, to IVF. Along with that, we do have intensive care unit with NICU setup and also a beautiful state of hospital for everyone in inpatient patients. Right from dialysis to almost the complex surgeries are what we perform at our center. So today I am here as one of the awardee of India Brand Icon Award and got an opportunity to speak on Baby Chakra. Thank you so much. And my today's topic is urinary incontinence in females. So if I tell you about urinary incontinence, the word itself is very well explanatory. If I talk about urinary, which is urine, and incontinence is involuntary stopping of urine, is what exactly the meaning is to be talking about in the layman language. If I tell you about urinary incontinence, I can divide it into around three to four various types. Amongst that, the first and the very four important, which is found maximum, especially in females on this platform, since we are talking, is nothing but stress urinary incontinence. So the word stress itself gives you a explanatory in case of any stress. So be it, even something like lifting heavy weight or doing some kind of exercise or even certain jogging, or if I would suggest even things like coughing, or even if you're in the middle of many females and you're laughing out. So a lot of females in that matter do experience something called as leakage of urine, and that is involuntary. So this is the main stress urinary incontinence which we'll be dealing with today. The second one is the urge incontinence. Urge, as the word suggests, urgency. So it is somewhere where even before reaching the washroom, a female or a male experiences a sudden leakage of urine, and that's called urge incontinence. The third I would be saying would be the mixed incontinence. That is, someone having stress and urge incontinence in together would be the mixed incontinence. And the fourth one we have is the functional incontinence or the overflow incontinence. So in this, what happens is uh, urgency, as we talked about, functional incontinence and urgency would not be talking in detail since it is something which is related to the nervous system. And the neurology opinion should be seeked in that case. Yes, but definitely at our preliminary level, what we do is we actually differentiate the patients to actually know which exactly are they falling into. Is it the stress urinary incontinence or the urge incontinence? So, if I talk about stress incontinence, a lot of people would be asking us, what are the causes? Why does this happen, and why only mostly with females? See, if I would suggest, if I would really enumerate the number of causes which are required for having stress urinary incontinence, is first is the age. Very, very important. A lot of females after a certain age, like maybe 40s or 50s, in the 50 decades of their life, do have this complaints. But then, yes, a lot of time you would have females in the vicinity telling you, okay, this is normal, and this is not something that only you have it. There are a lot of other females around do have it. So this is something called as the stress that is the age related. Second is with parity. With parity, as I mean, the females who have delivered normal babies. So normal deliveries, that is either one or many, or every female who's undergone a pregnancy, who has undergone a pregnancy, those do have. So this is, as I told you, in stress urinary incontinence, what happens is there is something there's as I've just explained in short, is you have a pelvic diaphragm. So this is like your proper pelvic muscles, the lower muscles. So these are the the pillars of your genitals, I would say. And the urethra and the vagina, they pass from this pelvic diaphragm. So what exactly happens with pregnancy or with normal deliveries or with any kind of age is this pelvic diaphragm becomes weak. So when this becomes weak, so definitely the support system of the urethra and the vagina becomes loose, because of which you have loosening out there. Because of which, what exactly happens is whenever there is a urine leakage, whenever there is a stress, like whenever there is a stress from above, from the abdomen, like I mentioned in front, cough, sneezing, lifting heavy weight, or even simple things like laughing. So all these things also do result into slight urine leakage, and that is involuntary. And then a lot of times female even try to avoid it, and it cannot be avoided. So this is what exactly is the problem, and this is what we will be tackling today in today's session. If I talk about why exactly this happens, this, as I mentioned you, many things. Obviously, there are a lot of other medical issues as well who have these kind of issues, like in cases with females who are obese. The one with overweight females also do have these kind of issues. Females taking antihypertensive drugs like blood pressure drugs, especially the beta blocker drugs. Then also females with diabetes. So the female with diabetes also do have some kind of urinary incontinence. So all these can be reasons to have urinary leakage issues, and which is, in my consideration, one of the major issues that should be really, really tackled as soon as possible. Imagine, if I give you an example, female is not able to have a proper confidence in her life. She's not able to go for a walk because of this. Imagine females who are not able to socialize. They cannot have a get together, or they cannot go for a shopping for long hours, or they cannot even watch a movie for long time. So these are the problems which females nowadays are facing because of stress urinary incontinence, or something like even spiritual problems, emotional problems. Female have problems in their sexual life, in their physical appearance. Imagine female is not very confident to stay out of the house or even party in that matter. So these small small things have really caused a lot of setbacks in females' life with this problem. So I have seen cases where people have not gone out of their house for months together, just that they know ki, what if they don't find a washroom? I mean, did few people, did they even think that this could be a biggest issue? They actually do bathroom mapping. They actually search, and they always go to a place where there is a good washroom attached. They do not even think of shopping in places where washroom tracking would be difficult. So all these things and together really matter a lot. If I talk about the treatment option, there are many treatment options which are available. First and foremost, what I would always tell is lifestyle modification. It's very, very important that a female has a good lifestyle. She should know what exactly she should be having. She should be having a good, genital hygiene. That's very, very important. Third thing is should not be having any kind of white discharge infection. She should not be having, she should have a lot of fiber-rich diet. Then there is something called as Kegels exercise. That's another where treatment options is. And in fact, I would suggest that's like the first treatment option for any kind of stress urinary incontinence. That is Kegels exercise. So talking about Kegels exercise in detail. So if I ask any female to stop her urine while she is urinating, so exactly the muscles that you use to pull your pelvic musculature down there to stop urine is exactly what Kegels exercise is. But remember, you are not doing this exercise while you're urinating. This is especially for the females when they are sitting or they are working or television or they are on their mobiles. So this is the exact time when you should be actually doing this exercise. This exercise takes a long time to actually build your musculature of the pelvis and increase the tone, and in return form a good sphincter muscles. And this is where the stress urinary incontinence can be tackled. Other than that, there are a lot of other medications which are given, which are the opposite of the antihypertensives or the drugs. There is a lot of medications which are there, but then not all of them can be used for every patient per se. Then I talk about the latest technology which we use in our hospitals is the laser treatment. We do have one of the HIFUs, that is high intensity focused ultrasound technologies. So this is something which I would really propagate here as if you want to have a treatment which doesn't involve any admission, which is a scarless thing, which doesn't have any anesthesia, doesn't have any bleeding per se. So this is just what it works on is uh, any lasers or HIFU in that matter does it actually just increases the blood circulation in the vagina, it increases the collagen content, and then in turn has a good pelvic musculature tone and then helps in the stress urinary incontinence. And believe me, doing one uh, lunchtime procedure, which would really would do so much of impact in a female's life that really it would help not only in getting things done and also live her life to the fullest. If I talk about one case that I would suggest, in this case, what exactly happened is she is 57 years old female. Imagine a female who is leaking urine every night. She is bedwetting every night. So for her, even getting out of the house is like a boon. She just cannot think it's like a nightmare. She cannot talk to her family members. She cannot have an active conversation where people are laughing around because she feels that she will just leak out urine and she'll land up into a huge embarrassing situation. So these one of these cases which we have done and which is really registered with me is with even one session of HIFU, which we did, she showed even 85% of improvement. That she said that it's been since last 10 years that she was bedwetting and now she's really improved a lot in that. So this is what the results are. And on top of this, there's also gives an added advantage of these laser treatments. All this HIFU is they even give you a good vaginal tightening and also in females because of the loose vagina. So a lot of females, especially in India, don't talk about the enjoyment of sex going low, or they have a low drive, or they don't enjoy the sex as they used to before marriage. So this problem can also be tackled absolutely well and gracefully with this procedures. So even things like one more which can be added with this is doing a PRP. So I'm sure everyone out here would have heard about PRP being one of the which is used on hair, and nowadays we use it even in ovaries and for even kidneys and then joints and skin and everywhere altogether. So now PRP is something which we even use musculature for the genital mucosa. So what exactly that gives is it again improves. PRP is nothing but platelet-rich plasma. So this is definitely only the woman's own blood, which is then processed and then it gives out of the 20 ml of blood or maybe 10 ml of blood that we take, it just yields around a ml or a 2 ml of PRP. And this what is even injected with the slightest smallest injection, which doesn't need any anesthesia. And this is injected inside the vagina and definitely near the urethra. It gives such a beautiful results in few days that the surgeries which we used to operate few years back are no more done now because tackling with all the complications related to the surgery. We used to do a lot of colpo suspensions. We used to do a lot of sling surgeries, but then now all of them are not required. Believe me, guys, avoid of any kind of surgeries which are done previously, which actually goes with the cost factor, the admission factor, and all the complications related to it. So definitely now the treatment option changes as the revolution happens. And yes, now we are here with beautiful laser treatments, even for the vagina and for the intimate health down there for females. And uh, talking about a lot of other things which we do in cosmetic gynecology is also we do O shot. I'm sure everyone have heard about G spot. So G spot is nothing but it's one of the areas also called as orgasmic shot. So this is G spot is an area which is there in the vagina and which maximum gives pleasure while a female has an intimate relation. So what exactly is done is this area is augmented. So imagine a female having a 20 or 30% of enjoyment in one intercourse, and after the enjoyment, after the O shot, she actually gives difference of 50 to 60% on the first day itself. So that is what uh, is the difference that we create in a female not able to have sex. We have even talked about or discuss about mommy makeovers. So nowadays, the females that we deliver, so we sensitize them right from start that you will no more have a loose vagina after delivery. So people nowadays don't opt for normal deliveries with the scare of getting a loose vagina in future. But believe me, so nowadays we can even actually go back and have a mommy makeover. So in this, right from the tummy tuck to the vaginal tightening to O shot to even slightest chin lift, or you want to do some thigh smoothening, or even your buckle handle tightening muscles, all can be done, and a female can really get back to her pre-pregnancy state and not have any kind of urinary incontinence issues while she goes back to the gym, or she's able to take care of her family, or she's doing her job. So all that really 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 matters, and believe me girls, I'm here out there to really solve each and every question that comes out there, for people out there to really reach out to us and get a treatment. Everything can be possible. Don't sit. I'm here as an obstetrician just for females, right from 10 years to 80 years, with any and every slightest complaint can be really tackled very, very, very well. And that is how this baby chakra is a small disc. Uh, for us to really communicate. So I think now I'm done with the topics which I was given. In case if you have any questions, we would really, really appreciate that you can put in the chat box down there, and I could answer them for all of you. I have one question which says, is urinary incontinence more common in men, women, or children? As I very well mentioned, urinary incontinence is common in males and females both. But definitely, when you say more common, it would definitely be more to the women's. And males also to some extent, but uh, only in few cases where there are cases of prostatic hypertrophy or chronic constipation or obesity or with chronic infection or anything like that. In case of kids, it is not that frequent. The only thing that you need to train your kids is about hygiene. There are a lot of kids who don't visit the washroom, whether they are in the school or they are in the playground, with the scare of missing on something. So I think that control of urine for longer hours, this is something which is more common, I would be saying, in children's. Yes. What other symptoms occur with urinary incontinence? If I am talking about urinary incontinence, as I mentioned earlier, as also, there are a lot of females who actually come with even slightest infection. like white discharge could be there. There could be frequency of urination in case of urinary tract infection. In case if you have a urine infection, also you have incontinence. Then, in case if you are taking, some drugs or some medications which allow you to have a lot of urination, and then that's not able to control, that could be also one of the reasons. And along with that, if you are pregnant, in pregnancy, we have seen that these cases are a little more, and females who are more obese or females who have diabetes. So in all these cases, we see urinary incontinence along with these symptoms. Yes. We already mentioned about the types of treatment which are recommended for urinary incontinence. But definitely, if I talk about in short about the treatment options, first and foremost, we have the lifestyle modification, which we've already talked about first. Second is about the Kegels exercise. Definitely, if I'm talking about stress urinary incontinence, it's the Kegels exercise, which is very, very important. Believe me, people, you have to do this exercise at least for 3 to 6 months minimum to 1 year to really see results. The third most important thing which we are doing, and it's in trend now, is the laser treatments, and along with PRP and O shot. So these are also one of the treatment options. The fourth and last I would suggest would be the surgeries that we mentioned about, the colpo suspensions, the sling surgeries, the Murphy's repair, the needle surgery. So all these which people still do, but yes, associated with complications and not great results. So these are also one of the things which people do opt for, and these are one of the treatment options when I talk about urinary incontinence per se. What lifestyle changes can help reduce urine leakage? See, as I said, urine leakage or incontinence is because of some stress. So that could be because of coughing or, you know, so people, if I talk about coughing, so obviously people with COPD, like chronic pulmonary disease patients, or patients with chronic laryngitis, or who have, asthma. So all these patients are the ones treating their ailment is very, very important, and which will in turn turn their urinary incontinence into no continence. That's one. Second thing, the females with constipation or kids with constipation. Very important for them to have a good fiber diet. Very, very important. You need to actually set a timetable. You need to have an alarm placed in case a lot of females I get nowadays working for hours and hours in their offices or work from home don't remember to even drink water or don't remember to even visit the washroom. So, actually having a good timetable for urinating and genital hygiene is what I would really suggest. Even smallest thing, like I am sure if I ask a general question for everyone, how many females out there, whenever you visit to the washroom, I'm sure 99% of them flush that area, right, with water. But is there anyone, how many of you all actually dry that area well? Believe me, one smallest thing, even using a tissue paper or some soft napkins, which are used specially only to clean that area, would really make hell of a lot of distance. I mean, a lot of difference, I would say. So, getting a good hygiene, keeping dry out there, not allowing too much of hair to grow, clipping them regularly, having a good vaginal wash, and maintaining that pH out there would really, really cause a lot of difference and definitely add to one of the benefits of treating incontinence. Overactive bladder is what I would be calling. Is we talked about the urge incontinence. So this is similar to an overactive bladder. So this is in females where there is too much of filling of urine in the urinary bladder. So what exactly happens is this is a neurological issue. Okay, girls. So this is in case of, see, whenever you pass urine, there is a lot of signals which goes to your spinal cord, in turn to your pontine areas and in the brain. So they send out signals, and our body or the sphincters they open up. The sphincters are something which hold the urinary bladder and the urine. So they open up, and the detrusal muscle contracts. So detrusal muscle is the one which is responsible for contraction and emptying of the urine from the urinary bladder. So what exactly happens in overactive bladder is, so this detrusal muscle, the outermost layer of the bladder, contracts in a fashion where it just contracts and out, contracts and out. In this, there is no sustained contraction, or it is an overactive contraction, wherein there is simultaneously some leakage of urine whenever it contracts. So instead of a stress urinary incontinence, there's the muscle of the bladder itself which is involved and which leads to urgency. So this could be in one of the cases where it they have an involuntary leakage and it cannot be stopped. This is, you need to seek a neurological advice for this. A neurological neurophysician would be one of the best people to actually find out and treat it. If you have any more questions, take away message. I think we've been speaking about this. Yes, very, very important. I would suggest, please don't take any complaint very lightly. Nothing is no thing, you know. Don't talk to your friends. Please seek an advice for any and everything that you feel is not normal from what you were before. As a doctor, as a gynecologist, we are here specialized only to treat your complaints. If you feel that something which is not there with you before and now it is, even if you're, so I am here to just correct you physiologically and functionally. Cosmetic gynecology is something which is not just cosmetic or aesthetic gynecology, it even treats the functional part of it. So, be it having a good look down there, or if you feel that the vagina is very loose, if you feel something is coming out, you have some popping out of things coming out in your vagina, or if you feel you're not able to enjoy sex, or if you feel you are not the same what you were before, or you feel you are not able to go to the gym just with that one thing in mind that, okay, I would leak urine and it would be embarrassing. Please seek out help. Things are not the same what they were, and don't listen to your grandmothers and sisters and your mother telling you कि this is normal. ये हमको भी हुआ था, ये आप भी हो सकते. See, if I talk about what we did before and what kind of exercise that our mothers and grandmothers did before is not what we are in now. We are totally different. We are totally work minded people, and things have changed. The generation has changed. So, definitely, the treatment changes. So, what I would suggest is, please seek out help in case even slightest thing. If you're talking about getting pregnant, people are getting late marriages, late pregnancies, infertility issues, stress, stress at work, stress at home, difficulty in managing the hygiene part. Every month or every 2 months having pain in the abdomen or urinary complaints, anything in that matter should be tackled. And that is why we gynacs are here to help you out in each and every problem of yours. And yes, when it comes to stress urinary incontinence, as I said, have a good timetable of yourself, have good hygiene, have a good diet which is rich in fiber, and see to it that you do your Kegels exercise. And I advise this for every female. We even do have some machines which are used for Kegels exercise. There are these hyphen chairs. There are these chairs on which even if you sit for 20 minutes, there are 10,000 sittings of Kegels that can be done. So there have been advances in treatment. So please go ahead and really, seek help for that. And definitely, you can be what you were. What we talk about, a mommy makeover. Yes. Do we have any more questions, Ayushi? Great. Thank you so much, everyone, for being here this afternoon and really helping us tell you what exactly it is and how urinary incontinence can be treated. Looking forward to connect you with all. Thank you so much and have a wonderful day ahead.